Hospitals across the metro area say they do not go a single day without someone attacking their staff. Nurses say they've been hit and bit and spat on, and it's only getting worse.
Now hospitals are very publicly cracking down on that violence. 9 News reporter Cole Sullivan joins us from outside Denver Health. And Cole, Denver Health is dealing with the same kind of attacks on their people as other hospitals.
Kyle, typically nurses are the ones who are caring for bumps and bruises and scratches. Now they say they're the ones who need medical care, in part because they say that they're getting attacked by their own patients in growing numbers. It's not just happening at emergency departments and psych wards. Across the metro area, violence is visiting every floor.
This is this guy's first time, right?
Managing cancer nurses keeps Mary Johnson busy.
So chemo?
Keeping those nurses safe
It happens on my floor.
is only getting harder.
It happens everywhere in the hospital. It happens in clinics. It happens in exam rooms. It happens everywhere.
She says attacks by patients and visitors on staff now happen daily at Denver Health.
Hits, kicks, bites, spitting. I mean, there's choking. We've had that too.
The attacks keep increasing, and not just here.
It's probably doubled, at least in the last year or so.
The Common Spirit System, formerly Centura, now has resources for staff who file police reports against violent patients.
If they have to testify, to then actually pay for them to be at that testimony.
UC Health says nurse safety concerns could impact patient care.
If they walk in with fear, concern, there's opportunity there that a mistake could occur.
He says most staff are now so used to it, they work through the threats. But that can't last forever.
Healthcare workers are taking inventory as to whether or not this is what they want to do.
This is an issue that is impacting small and large, urban and rural. You name the type of hospital and they are encountering it.
The Colorado Hospital Association says the violence intensified during the pandemic, and now it just won't stop.
We're a kind of violent society, unfortunately, and I think sometimes, unfortunately, that's playing out even in the hospital.
And it's epoch 5 days.
Nurses on the front lines won't give in. Johnson helps lead Denver Health's Violence Prevention Committee, which launched a new educational campaign aimed at patients and visitors, but also staff.
And part of our education is to make it very clear that that is not part of the job.
But at her job, the attacks keep happening.
I am angry. I am hurt for the staff. And I feel like I have failed them because I haven't come up with this answer yet.
She says she's not done trying to come up with an answer to this epidemic of violence, and she's not the only one. The Hospital Association says it's appealing to legislators to try to help. They want lawmakers to increase penalties for people who attack healthcare workers. Kyle.
Yeah, and I mean, Cole, obviously these are folks that have that duty to care for anybody who comes in the door. You know, this isn't a sandwich shop where if you get mouthy, let alone physical, they can just toss you out.
And that's what we've heard from a couple of different hospitals today. They have a moral and ethical duty to care for anyone who comes through the door, even people who have a history of violence towards their staff.
Cole Sullivan, thank you.